all coming back from break, and we are going to get ready for session 2, which is State of the State. So I hope you have plenty of time to grab a snack, take a little stretch break. And now we are going to hear from the South Dakota Tobacco Control Program. First, we will hear from Kiley Hump, the administrator of the Office of Disease Prevention and Health Promotion within the South Dakota Department of Health, as well as Geno Adams, the Medical Cannabis Program Administrator for the South Dakota Department of Health, and Sierra Phelps, the Tobacco Program Director for the South Dakota Department of Health. They will each provide program and project updates. And then lastly, but not least, we will hear from Laura Gudgeon, the chronic disease epidemiologist for the South Dakota Department of Health, who will share with us new data that updates our tobacco control state plan. So let's give them all a virtual round of applause. And Kiley, I will hand it over to you.
Thanks, Hillary, and good morning, everyone. I hope you all are doing well. Just want to start off with a thank you to Hanrea for that presentation and just for being such a great partner for us here in South Dakota. Again, my name is Kiley Hump, and on behalf of the South Dakota Department of Health, I would like to thank you all for participating in our 2022 Spring Tobacco Control Institute, and for also being a partner with us in tobacco control efforts here in South Dakota. We could not have accomplished all of what Hanrea mentioned within our presentation without partners like yourself. We have a lot of great updates for you this morning. So I'm happy to start us off with our State of the State presentation. Next slide. We know it can be challenging to know who you are talking to and what role they serve within this work. So here's a high-level work chart for how the tobacco control program is staffed. In the light blue on the left is Department of Leadership, including myself. I'm the office administrator. Laura Strike is the deputy administrator, and Rebecca Pruderick as the communications coordinator. We provide overarching support to the program around staffing, budgets, and getting management approvals. And then the team of individuals you are all probably very familiar with, including Sierra Phelps, our tobacco program director, Hillary Larson, who you've heard a lot from today, is our tobacco program coordinator, Casey Redden, the tobacco disparities coordinator, and our contracted staff, including Caitlin Ashley, our tobacco cessation coordinator, and our 4 regional tobacco prevention coordinators, which include Ashley Heine, who serves the Northeast, Dynell Milner, who serves our central region, and Joan Lindstrom, who serves the West. And currently we have our Southeast position vacant. Next slide. Here's a map showcasing the tobacco prevention coordinators regions, which can also, this map can also be found on befreesd.com under About Us. So if you're not sure who to reach out to, starting with the tobacco prevention coordinator in the region that you serve is a great starting point. Next slide. As you just heard in Hanrea's presentation, there's multiple students that are vaping currently and that don't realize they're addicted to it. Many kids think that vaping's safe and that people don't realize the numbers are growing both nationally and here in South Dakota. In 2017, the rate of e-cigarette use for middle school students here in South Dakota was 2.5%. And in 2019, when we administered that same survey again in middle schools, that usage had tripled with 6.7% of students vaping. The national average for middle schools vaping is 10.5%. The 2019 survey also found that 1 in every 5 middle school students, which is 22.3%, had tried a tobacco product, with e-cigarettes being the most commonly used tobacco product among South Dakota middle school students. We know we need to do more education with teachers, students, parents, youth organizations, etc., to start combating this issue. In December of 2021, the Tobacco Control Program sent out a survey to school staff across South Dakota. Staff included, but weren't limited to teachers, nurses, principals, superintendents, and counselors. And 74% of responses stated that 9th through 10th grades are seeing vaping the most, followed by 11th and 12th graders, and 6th through 8th graders, and even K through 5th grade being reported. We had 38% of staff say they work with elementary elementary students, which under 2% specified seeing elementary vaping happening. The tobacco control program is currently working to create new materials, messaging, and promote more anti-vaping curriculums, such as Catch My Breath, to schools to help with the vaping epidemic. We hope to roll out this campaign in August of 2022 for the beginning of the 2022 to 2023 school year. The 2022 legislative session ended a few weeks ago, and as in previous years, we wanted to include a legislative update. This year, there was no tobacco-related legislation that came forward, but the Department of Health did monitor many different health-related bills, including medical cannabis, which I know is a topic that many of you are interested in as substance abuse prevention partners. So I'm glad we have Geno Adams presenting with us today to provide an update on the Department of Health medical cannabis program. So with that, I'll turn it over to Geno.
Thanks, Kylie. And thank you for allowing me to speak on the medical cannabis program this morning. The medical cannabis program initiated with the vote in November of 2020. So South Dakotans voted on both medical and recreational use during that voting time period. Medical cannabis and adult use both were voted on and passed at that time. Medical cannabis went into effect on July 1st of 2021, and I'll come back to recreational use here in a bit and talk a little bit more about that. There was a number of deadlines that were associated with the medical cannabis program, including administrative rules that had to be done by October. Patient cards within that law that was put into place July 1st, patient cards had to start being issued in November of 2021. We have a fairly limited staff when we started here to implement this new program. Myself, I started in July of this last year, and we also hired an attorney that works out of the Rapid City office that specializes in medical cannabis. We were allowed to hire another staff member in, I believe, December, Cody Westergren, and she helps with the portals, the patient portal and the establishment portal with all of the licensing and certifications and the patient cards. We also are hiring, and we'll have a new staff member starting, I believe, this Thursday that will be taking over some of the patient card duties as we continue to expand the program. We will also look to hopefully have another staff member starting that will be working exclusively with inspections of the establishments that are around the state. Hopefully that person will be on board here within the next 4 to 5 months. As well as Department of Health staff, there's also Department of Revenue staff that were hired once adult use went into place. Adult use did not end up going, the program did not end up going into place due to a number of reasons I'll talk about here in a little bit, but those Department of Revenue staff were already on board. So they've actually been a really big help for the medical cannabis program without that adult use program to work on. Next slide, please. So how does somebody go about getting a card, a medical cannabis card in South Dakota? Well, they have to, so if a patient has a medical complaint, they would do just as you would with any other medical complaint. You go to your local physician. The law dictates that you have to have a bona fide patient-physician relationship in order to get medical cannabis certification. So this is a physician-led system, and those patients would go see that physician, and then the physician would determine whether or not that medical cannabis might be something that could help that patient with their issues. So the physician would then have to create an account, and they would start the process by creating that account, a physician account, in which they can go in and certify patients. So once they get that account created and the department approves that account, they can go in and approve or certify that patient, at which point the system will send that patient an email. And so the patient would get into that email, and there would be a link that they could go and then create their account within the patient portal. And they would have to create that account, get that application put in, and then the department would have to approve their patient card, at which point they would be sent an actual physical patient card in the mail. So once that patient card arrives, they'd be free to shop at any local dispensaries that are up and running. Currently, there are not any up and running. That will probably come later this summer into the fall as these establishment types get going and grow the medical cannabis and get it into the dispensaries. There's also another option for those patients that they can do home grow, which means they could actually grow a number of plants in their house and use that for their own medical purposes. Next slide. So with the administrative rules and the laws, there are a number of restrictions placed on the program that kind of help with some of the what some of the perceived issues might be with a medical cannabis program. There's no use in public places, so any public places or public transportation, it is not legal to use medical cannabis in those areas. Employers are not required to allow use. So no employer is required to allow the ingestion of cannabis in any workplace, or they don't have to allow any employee to work while under the influence of medical cannabis. Similar for property owners, any person or establishment that is in lawful possession of medical cannabis does not, or of a property, excuse me, does not have to allow a guest, a client, a customer, or anybody to smoke cannabis or ingest cannabis on their property. So they can restrict that. Rental properties are included in that, so rental properties do not have to allow the cultivation of cannabis in a rental property. So if somebody has a patient card and wants to do the home grow option, they would have to check with their rental property before they did that. Next slide. So there are some restrictions on minors as well. There's an age restricted card holder status. So anybody that's underage or a minor would have to get an age restricted card, and that card would require them to have a designated caregiver. And that designated caregiver would be the person that they would be able to purchase the medical cannabis, and they would have to administer the medical cannabis and do a number of the process for the underage card holder. Anybody under the age of 21 cannot use inhalable products. So somebody that's under the age of 21 would have to, utilize edible products or something besides smokable products or vaping. And there's also some advertising restrictions that come along with the administrative rules. So the establishments can't advertise with, anything that makes it appealing to children. So cartoons and different things like that are restricted in advertising. Next slide. As far as schools are concerned, there's a rule, or excuse me, a law that dictates that these establishments, and an establishment is defined as the dispensaries, the cultivation operations, the manufacturing operations, and a testing facility. All of those establishment types, none of them can be within 1,000 feet of a school. That's the state restriction. There's also a number of local restrictions that local municipalities have put in place that further restricts where those can be. The Department of Education has a number of rules that guide use of medical cannabis in schools. They have an exemption that's allowed for school districts if they post a statement regarding their decision not to comply with this rule, and if they reasonably demonstrate that it will lose or they've lost federal funding as a result of complying with these rules, so they can kind of take themselves out of that process. More specifically, any underage patients that are in school, a caregiver must notify the school that they are a medical cannabis patient. They must present the patient card to the school, and the caregiver must administer medical cannabis to the patient. And students may not possess medical cannabis. The medical cannabis must be in a non-smokable form as well. And there are no requirements for the school or store, there are no requirements for the school to store or administer the cannabis. That has to be done by the caregiver. Next slide. So as I mentioned, kind of the elephant in the room with all this is the adult use program. Like I said, that was voted on in November of 2020 as well, along with medical cannabis. Medical cannabis went into place while adult use actually went to the Supreme Court. And there it was, it took a number of months for the Supreme Court to make a ruling on the legalities of how it was voted upon. And there are some technicalities in the number of topics that were put on the same ballot. And so the Supreme Court actually shot down the adult use or recreational portion of what was voted on in November of 2020. So that actually did not go into place alongside the medical cannabis program. That's actually why I say that's the elephant in the room is that the medical cannabis program is a very small program, a limited program in number of people utilizing it, while what we know from other states that have implemented medical cannabis and adult use, the adult use programs are generally much larger in scope than the medical cannabis program. So during the 2020 legislative session, there was a number of bills that aimed at getting that adult use recreational program back, but none of them passed. So next slide. This is an ever-evolving industry. People have told me from day one since I started that you'll be constantly chasing administrative rules, law changes that are associated with the program. And we saw that this in the first year. There was over 40 bills that were put into motion over across the street in the Capitol. And a number of those bills actually passed and changed various aspects of the program. So now we are taking a look at those administrative rules and seeing what changes they will dictate in the administrative rule from those laws that changed with the bills. So there'll be a number of those changes that come to the program, and it just started here in July of this past year. So that'll be a constant battle over time is following the industry and keeping up with the changes. And then of course there's that adult use and recreational aspect of it. If that gets back on the ballot in November of this year, we could see it as early as July 1st of the next year as a law change, which would mean a new program would have to be developed associated with that. So if anybody ever has any questions or issues with the medical cannabis program, they're free to contact me at any time. And I think that's all I have. Thank you.
Good morning, everybody. I'm Sierra Phelps. I just wanted to do a high-level highlight of some of the great work that's being done throughout South Dakota over our past year with our amazing partners. First is our community disparities requirement. The South Dakota Tobacco Control Program partnered with Missouri Breaks Industry. We are currently working with them in year 2 and going into year 3. Missouri Breaks received year 2 funding to continue to promote the toolkit and provide technical assistance to other tribes. 3 tribal representatives were interested in conducting tobacco prevention and cessation promotion by applying for the mini grant opportunity. 2 tribal representatives were awarded a mini grant. A 5-year strategic plan was developed incorporating building infrastructure, develop tribal partner relationships, and tribal toolkit promotion and maintenance. Guides are being created to build infrastructure. These guides will be focused on data collection, data sharing, and tribal approval process guidance. For the QuitLine, between January 1st of 2021 through December 31st of 2021, 522 electronic cigarette users utilized the QuitLine services. Of those 522 clients, 294 utilized the phone service option and 228 utilized the Kickstart kit. E-cigarettes only users and those who use e-cigarettes in addition to other tobacco products continued to be eligible to receive QuitLine services. Monthly South Dakota QuitLine advertisements were placed in the South Dakota Medical Journal, which is a monthly peer-reviewed medical journal read by physicians, residents, medical students, hospitals, and clinic administrators, and other healthcare leaders. Between January 1st of 2021 through December 31st of 2021, there were 356 phone coaching clients who received Chantix. Chantix returned as a cessation medication offered for free through the South Dakota QuitLine in January 2021. A new Quit Guide was developed in 2021 and now available for digital download on the South Dakota QuitLine website, or a client can be emailed a hard copy. Bidirectional text messaging continues to be offered as a supplemental communication method for QuitLine phone service clients and their coaches. This communication tool is used to send call reminders and encouraging messages between the coach and client. In 2022, the South Dakota Tobacco Control Program hopes to adopt a text message-based standalone cessation service for QuitLine clients. Recently, the QuitLine added a live chat feature on the QuitLine website that actually went live just last week. The State of South Dakota Employee Health Plan continues to encourage its members to utilize the South Dakota QuitLine. In 2021, the Tobacco Control Program worked with the State of South Dakota's Bureau of Human Resources to create a wellness option that offers points for completing South Dakota QuitLine phone coaching sessions, which can be put towards a monetary incentive in the form of a health savings account fund. We reached 13 state employees with a total of 55 coaching calls. In our prevention efforts, the South Dakota Tobacco Control Program provided education for stakeholders through webinars that included 6 best practice webinars. Information provided within these webinars consisted of working with behavioral health facilities, the South Dakota QuitLine, how to make activities more impactful, the South Dakota Tobacco Control Orientation Toolkit, Evidence-Based Practices 101, and working with people of low socioeconomic status. The Tobacco Control Program held Teens Against Tobacco Use trainings virtually during the months of October and November via Zoom or Microsoft Teams. These trainings served 29 schools and 3 Boys and Girls Clubs. Throughout South Dakota training, a total of 267 youth were trained. Point of sale surveys began in July of 2021. Currently, 2 of the 5 participating coalitions have completed their surveys with a combination total of 105 surveys submitted. Data is being reviewed for next steps of creating material coalitions can use to educate the stores and community members with the youth who took part in these surveys. Next slide, please. A big focus this coming year will be working with behavioral health facilities. Nationally, nearly 1 in 4 adults have some sort of mental health condition or substance use disorder, and these adults consume almost 40% of all cigarettes smoked by adults. Half of South Dakota QuitLine callers reported having a mental health or substance abuse disorder in 2016. The South Dakota Tobacco Control Program currently has 351 healthcare facilities that have submitted tobacco-free building and grounds policies, with 58 of those healthcare facilities focusing on behavioral health. The program continues to work with Southeastern Behavioral Health to pilot a program to increase enrollment into the QuitLine. This pilot program focuses on the individuals enrolled in Southeastern Behavioral Health's medication management services for individuals living with severe mental illness who struggle with housing. The program has joined with Phelps County Jail to pilot program to provide QuitLine services and nicotine replacement therapy products to incarcerated individuals. This pilot program focuses on the individuals at the Phelps County Jail for individuals that have been incarcerated, which many of them are due to substance abuse. The program focuses on low socioeconomic status individuals and people with behavioral health conditions. The program is also working closely with the National Behavioral Health Network to accomplish our objectives within our work plan for the behavioral health component. We have 4 objectives this year. Assist 2 behavioral health facilities in adopting written comprehensive 24/7 tobacco-free buildings and ground policies. Use online trainings and in-person trainings to educate staff at 8 behavioral health facilities, 2 in each region of the state, and discuss with them how to use tobacco use with patients to refer to the South Dakota QuitLine. Provide tobacco prevention and cessation education materials for staff in 25 behavioral health facility programs and organizations. And last, encourage inclusion of tobacco cessation and behavioral health treatment plans in 2 different facilities. As an update today, we have engaged with 6 different facilities who are up to doing trainings, receiving materials, and implementing some of this policy work. So I have a great faith in our work coming up this year. The Youth Tobacco Survey was conducted by SDSU currently. They developed an online application that is being conducted this spring instead of fall like usual. Having the survey online saves time, cuts down on skip patterns for students, and cuts down on classroom time. Overall, this new procedure is a win for all. The data will be cleaner and we will have a better response rate. And the last update coming for this year is the South Dakota Tobacco Control Program is currently working with Emory to gain new perspectives about our funding opportunities. Grantees, both past and present, are being interviewed to see what works well and what doesn't work for this grant. With this feedback, we hope to redesign the Community School Partnership Grant and implement many of the suggestions that grantees make. I would like to extend a huge thank you to those that have and will take this survey. The South Dakota Tobacco Control Program values the great work that you do and appreciate your feedback to help make our funding opportunities even better. And with that said, with all of our efforts, that leads into Laura Gudgeon with updates on our data.
Good morning, everyone. I'm Laura Gudgeon. I'm the chronic disease epidemiologist with the Department of Health. And today I'm going to review data on the state tobacco control plan from 2020 through 2025. Before I begin, I just wanted to review the highlights of the plan, the vision. So all South Dakotans will enjoy healthy lives free from the harms of tobacco. And our mission is to enhance the quality of life for all South Dakotans through prevention and reduction of tobacco use and exposure. Also wanted to take note of our priority populations, American Indians, those with behavioral health conditions, those of low socioeconomic status, pregnant and postpartum women, youth under 18 years old, and young adults aged 18 to 24 years old. Next slide, please. Also wanted to review the data sources for the state plan. The Youth Tobacco Survey collects data on middle schoolers and is given every other year. The most current year of data available is from 2019, and the next results will be available this coming spring. The Youth Risk Behavior Survey collects data on high schoolers every other year. Most current year of data is from 2019, and new results will be available this summer. And also the Behavioral Risk Factors Surveillance Survey, also known as BRFS, collects data every year on adults, and most current year of data available is from 2020. Next slide, please. We'll start out with goal 1, prevent tobacco use among youth and young adults. And we have 3 strategies to support the following objectives. Educate partners, decision makers, and the public about tobacco marketing and sales tactics that target youth. Adopt comprehensive 24/7 tobacco-free buildings and ground policies at all educational institutions, and advance evidence-based policy systems and environmental changes that discourage tobacco use among youth and young adults. Next slide. Objective 1 is to decrease the percentage of middle schoolers who have ever smoked cigarettes from 9% to 6%. In 2011, 14% had ever tried smoking cigarettes. This since has slightly decreased to 9% in 2017 and up a little bit at 11.3% in 2019. Next slide. Measure 2 is to decrease the percentage of middle schoolers who have ever used e-cigarettes from 8.2% to 7%. In 2011, only 1.7% of middle schoolers had ever tried e-cigarettes, and this has increased every year up to 5% in 2015 and up to 16% in 2019. Next slide. Measure 3 is to decrease the percentage of high schoolers who have ever smoked cigarettes from 31.4% to 25%. This has decreased over the years. So in 2009, 48.8% had ever tried smoking cigarettes, and this has decreased to 31.4% in 2019. Next slide. Measure 4 is to decrease the percentage of high schoolers who have ever used e-cigarettes from 50.6% to 45%. In 2015, 41% had ever tried e-cigarettes, and this has increased to 50.6% in 2019, similar with the national average with 50.1% in 2019. Next slide. Objective 5 is to decrease the percentage of young adults 18 to 24 who regularly smoke cigarettes from 18 to 10%. In 2016, 13.6% smoked cigarettes, increased to 18 and 19% in 2019, and back down to 11.9% in 2020. Next slide. Objective 6 is to decrease the percentage of young adults who use e-cigarettes from 9.8% to 8.8%. Only 4.2% used e-cigarettes in 2016, and this has increased to 19% in 2018 and 2019, and is at a 13.8% in 2020. Next slide. Moving on to goal 2, so promote quitting of all tobacco products. So we have 3 strategies to promote to support the following objectives. So implement health systems approaches that promote cessation and tobacco-free facilities, promote interventions that support cessation in community settings like workplaces and schools, and enhance existing cessation services to include cessation of emerging products and to leverage new technology. Next slide. Okay, so objective 1 is to decrease the percentage of adults who currently use tobacco from 26 to 23%, 23.4% in 2016 used any type of tobacco, and has increased to 28.5% in 2019 and 28.1% in 2020. Next slide. Measure 2 is to increase the number of tobacco users enrolling in the South Dakota QuitLine services from 5,520 to 5,900. In 2017, 6,088 had enrolled in QuitLine. At that time, it was at its peak and since has been declining every year down to 3,215 in 2021. Next slide. Objective 3, decrease the percentage of pregnant women who smoke from 11.8% to 7%. This measure has decreased every year with 13.6% in 2016, down to 11.8% in 2018, and has decreased again to 10.1% in 2020. Next slide. Objective 4 is to decrease the percentage of young adults who currently use tobacco from 26.3% to 23%. There has been some increase here with 21.4% in 2016, up to 40.2% in 2019, and at 34.9% in 2019. Or I'm sorry, that would be 2020. That was a table there. Objective 5, decrease the percentage of high schoolers who currently use tobacco from 29.7% to 20%. In 2015, 30.3% of high schoolers had used any type of tobacco, and at 29.7% in 2019, with the national average at 36.5%. Next slide. Objective 6 is to decrease the percentage of middle schoolers who use tobacco from 7.3% to 6.5%. So in 2013, 6.4 had used any type of tobacco, and this has increased to 9.8% in 2019. Next slide. Moving on to goal 3, so tobacco exposure, and eliminate all types of exposure to tobacco use. So we have 3 strategies. So advocate for smoke and e-cigarette free housing, advocate for tobacco-free parks, recreational areas, and rodeo grounds, and advocate for tobacco-free workplaces. Next slide. Objective 1 is to decrease the percentage of high schoolers who are in the same room or car as someone smoking from 33.4% to 24%. This has decreased every year with 53.6% in 2009, down to 42.6% in 2013, and decreased again in 2019 at 33.4%. Next slide. Measure 2 is to decrease the percentage of middle schoolers who are in the same room or car as someone smoking from 26 to 20%. In 2011, this was at 30%, and 2015 at 27%, and also at 27% in 2019. Next slide. Objective 3 is to increase the percentage of adults who report smoking is not allowed anywhere in their home from 85.8% to 94%. This has remained fairly stable at 89.4% in 2016 and 88.8% in 2020. Next slide. Objective 4 is to increase the number of tobacco-free park policies in the state policy monitoring system from 5 to 10. There was 1 policy added in 2017, another 1 in 2018, and 3 in 2019. And we are maintaining 5 current policies in 2021. Next slide. And moving on to goal 4, health equity. And we have 3 strategies for health equity. That is to use the tribal tobacco advocacy toolkit to encourage tribal governments to adopt comprehensive smoke-free air policies, enhance reach of cessation services to priority populations by reducing barriers and offering accessible targeted services, implement approaches that promote cessation at behavioral health facilities, including creating tobacco-free facilities and referring patients to cessation services, and educating partners, organizations that serve priority populations and the public about tobacco-related disparities. Next slide. We have measure 1, decrease the percentage of American Indian middle schoolers who report have ever used e-cigarettes from 17.5% to 15.5%. 2017 was at 17.5%, and this has increased to 24% in 2019. Next slide. Objective 2 is to decrease the percentage of American Indian adults who currently use tobacco from 47.8% to 43%. This was at 56% in 2016 and at 47.8% in 2018 and at 51.7% in 2020. Next slide. Measure 3 is to increase the number of tribes with comprehensive smoke-free air policies from 1 to 3. There was 1 smoke-free air policy implemented in 2015 with 9 total American Indian tribes. And this policy has been maintained into 2021. So next slide. Objective 4 is to decrease the percentage of Medicaid recipients who use tobacco from 41.4% to 37%. This was at 44.5% in 2016 and at 49.1% in 2020. Next slide. Measure 5 is to decrease the percentage of adults with behavioral health conditions who use tobacco from 33.1% to 29.5%. This was at 32.4% in 2016 and has increased slightly at 38.5% in 2019. Next slide. Great. That is all I have. Thank you, everyone, for listening. Is there any questions or comments for me? If not, I will turn it back over to Hillary.
Thanks, Laura. Are there any questions for any of our State of the State speakers? I did get a couple ones privately sent to me, but is there any other? If you have any other ones, feel free to put them in the chat. Let's see here. I'm guessing we're talking about the YTS here. When will we be able to see the new data for the survey? Sierra, do you know the answer to that?
I believe SDSU will finish things up in May. I guess I don't have an exact timeline of when they'll be able to publish that information, but we should have it sometime this summer, and we will let everybody know as soon as it is published for release.
Let's see here. The survey DOH sent out to schools in December. So Kylie, I believe you hit on this, but I don't know if you or Sierra wanted to talk about it. The e-cigarette usage among students, are we able to share that data?
I can answer that one. Yes, we can share that data from our vaping school outreach survey. I don't have it quite cleaned up that well yet. So since we do have people of interest that would like that, give me till about maybe the beginning of May. That might be way too much time, but just to not cut myself short, I'll gladly get that cleaned up and we can send that out to the partners if you want that information. And then also to highlight on that, we also have an infographic that we updated in September of 2021 that does highlight a little bit of middle school and high school cigarette and vaping use. We do have that out on our DOH publication page, but I can also send that digital. I think, Hillary, you are sending an email out after this or after the Spring Institute with some follow-up information, and I would be glad to attach a digital version of that. But if you would like a printed copy, we do have those out on the publication page for free if you would like that as well.
Perfect. Can tobacco funds with the grants be used for cannabis education?
I can go ahead and speak to that. I would say not at this time. You know, the funds that we do have available, both federally and state funds, are not for cannabis prevention and control efforts. And so at this time, our funds cannot support that education.
Geno, this one is for you. What resources are available out there for maybe property owners or anyone that's looking for more information?
Yeah, so we have the MedCannabis website. So it's medcannabis.sd.gov, and that's where we house all of our information on the state program. So that'd probably be the best place to go. The administrative rules, they're not exactly the most exciting read in the world, but they really do have the guidelines for the entire program and everything that somebody might need as far as rules are concerned with medical cannabis.
Perfect, thank you. Let's see if there's any other ones coming in here. And Alexis did drop that website into the chat if anyone's looking for that. Another question, will there be talking points regarding medical cannabis for those under the age of 21 and for adults to share with partners, community, schools, etc.?
Yeah, we don't have anything like that right now, I guess. That's something that we can definitely talk about. I can talk about it with Kiley and her crew to see if there's something that we could come up with.
And I know, these slides were included within the presentation. And so, Geno brought forward a lot of good points about, the administrative rules and how they apply to schools and in public places and things like that. And so those are all things that you will all have access to now and heard today. But we will definitely discuss further about maybe bringing those all into a one-pager talking points, if that would be helpful for you all.
And I would also point out that, it's a little different program than a lot of Department of Health programs and a lot of programs in general, as far as health and safety are concerned. There's not a lot of research that's been done in the last 20 to 30 years on medical cannabis. So when when people are looking towards literature and research, there's just not a lot to support a lot of this. So when you're trying to come up with some of these points and these health and safety, from the health and safety aspect of things, there's not a lot of guidelines there in the science or in the literature to help with that. So it is kind of a different animal than a lot of other health programs.
Always good to know. Let's see here. Oh, we got quite a few questions rolling in now. The trends in tobacco use appear to be increasing. Do you have any ideas to what is going on there? Any speculation?
I guess my question is what kind of data point are we specifically looking at? Is it just in tobacco use as in general?
I'm gonna guess in general.
Well, I think Aurea talked a lot about, what's happened in the past, where things are going, different emerging issues, things like that. I think she covered a lot of points that, could answer that question or things to be thinking about or considering. So I'm not sure that I would have anything to add outside of what Andrea kind of talked about this morning. I don't know if anybody else on the tobacco team have things to add, but.
Let's see here. So it was mentioned the pilot programs we have with the QuitLine. Where can someone go to find more information about those programs if they are interested in learning more? Or is there any additional information you have about them?
The best one I can say is, since it's still a pilot program, we haven't had any materials developed yet, is to reach out to our disparities coordinator, Casey Redden. She would gladly take you through a training on getting set up for one of those pilot programs to work with our QuitLine to help those populations. And I can drop her information in the chat below.
Some really good questions. And Casey's email, Sierra just dropped that in the chat. I guess this is going with the trends and just with everything changing. With the anti-vape campaign, trying to summarize this here a little bit. What could partners be doing to help support that effort as we get that kicked off?
Sierra, I don't know if you want to touch base on kind of your thoughts. I know we're just in the process of working, thinking through what all is entailed into that campaign. I know just a lot of what we, with that survey, is just really identifying where the need is. So I know, there's some discussion about just even what that looks like. We haven't done much messaging or education at the elementary level. And so we're just having beginning conversations about what that would look like. But we are looking to kind of put together, large package of materials for schools to utilize within their districts across their different school levels to help just get the education out there about the dangers, especially with youth with vaping. And so I know we're still in kind of earlier discussions about pulling all that information together and what that looks like. So we will be looking specifically to schools, but also just in general, youth organizations can utilize a lot of these materials. And so definitely more to come, but that's kind of our initial conversations at this point.
I would also add maybe that we were wanting to push some of those curriculums that I know others highlighted as well and kind of bring up catch a little bit more, including tattoo. And since we have a lot of partners working with schools, I think that'd be a really great thing to kind of push more of those curriculums out there. I know Hillary and Tynell do train some of those for catch. So, I mean, getting trained and knowledgeable in those curriculums would also be very helpful to promote that information. Not only just to our youth, but also the parents, teachers, and providers are also kind of on that list that we'd like to educate to, since many are unaware of a lot of the information that's out there on vaping.
Great. Is there any other questions that anyone has? Feel free to put them in the chat. Just another minute here to see if any other ones come in. Will the vaping curriculum include the THC pens?
I don't believe so. I know that some of our curriculums are making updates, but I have not seen that. Hillary, you can correct me. I know that you went through the updated trainings on catch. I did not catch that part if that was updated, but I don't believe it was in there.
It was not on this last round. I know Catch My Breath has been asked about it, and Kynell, not to call you out, but you can hop on and correct me too if needed. But I believe they don't plan on necessarily adding THC into their curriculum, but they may do like a small little like nugget of information in there just to address it. But otherwise they are leaning on the curriculums that are actually surrounded or meant for those products, is my understanding. Will the catch curriculum be updated soon? My understanding is yes. In terms of the data, they said they were going to be updating it this spring. So I don't know if that means March or if that means April. But yes, it should be getting updated here soon. So just keep checking back and can hopefully send an update on that for those of you that have taken our training when it is updated.
Hillary, one thing I just thought of when they brought up that question on THC pens, I know with our management team, we talked about with this new vaping campaign, anti-vaping campaign is talking about educating folks on what all you can put in vaping products. So just bringing awareness to parents, to teachers about, what all you can put in these pens when it comes to bath salts or nicotine or THC. I think just bringing awareness that these products, you can use lots of different substances within these products. And so just bringing general awareness around that is also part of things we're looking at for this anti-vaping campaign.
Thanks, Kylie. Another question that came in is, are there being updates made to our publications that are produced by the Tobacco Control Program? And if so, do we have a time frame of when?
I guess my question is, which publications are we talking about in general? I know we kind of update the data ones, or the ones that provide data. We try to get those updated as frequently as possible. But otherwise, I'm not sure on the other ones that you're asking about.
I'm guessing it's the ones that you can like order on our website and have mailed, but I don't know which one specifically.
A list was sent from our coalition, the Sioux Empire Coalition, through Casey last year when we made our application for our grant. So we were told that they were being updated, the apartment manager's guide, etc. There's a list of them that we sent, asked if they were going to be updated or reviewed.
Yes, some of those materials are being reviewed and hopefully will be updated. I don't have a timeline. We are in a change process coming up soon, so our timelines kind of got a little bit shifted with our vendors. Once we start that process, though, we will let you know and give you more of an exact date of when we plan to have those updated, but it is on our list to get those updated in the next year, though.
All right, any other last minute questions? Okay, it looks like we don't have any more coming in. So thank you to Kylie, Sierra, Geno, and Laura. We appreciate you spending some time to update us on everything. We will take a short break here, and we will have everyone come back at 11:45 Central Time or 10:45 Mountain Time. And so we will see you in a little bit. Thank you.